The news. In the last 2 months, at least 5 people, 4 in Florida and 1 in Texas, have been infected with malaria in the United States. The Centers for Disease Control and Prevention said in a health advisory on Monday. These are the first known cases of locally acquired malaria in the country since 2003. Malaria, once endemic in the United States, is caused by several species of parasites transmitted by Anopheles mosquitoes. It often causes flu-like symptoms, including a fever and chills, but can lead to serious disease and death when left untreated. The new cases were caused by Plasmodium vivax, which is less likely to cause severe disease than some other species of malaria parasites. All 5 patients have received treatment and are improving, the CDC said. Despite these cases, the risk of locally acquired malaria remains extremely low in the United States, the agency added. Image a close-up view of a feeding Anopheles mosquito on human skin. A female Anopheles gambiae mosquito, which carries malaria, credit, James Gaffney U.S. Centers for Disease Control and Prevention, via Associated Press. Why it matters. A resurgence in travel could lead to more cases. The United States eradicated malaria decades ago, but globally there were nearly 250 million cases of malaria in 2021, a vast majority in Africa, according to the World Health Organization. Before the COVID-19 pandemic, about 2,000 cases of malaria were reported in the United States each year. Nearly all of them in people who acquired the disease abroad, the CDC said. Pregnant women can transmit the parasites to their children, and the disease can also be spread through blood transfusions. Although such incidents are rare in the United States, according to the CDC, the country typically sees 1 case related to transfusions every 2 years, the agency says. But when people who are infected in other countries return to the United States, local mosquitoes can feed on them and pass the parasites on. Stuff like this happens. Colin Carlson, a biologist at Georgetown University, said. You expect that in a country that has achieved disease elimination, every now and then you'll have reintroductions, and a little bit of local transmission. Dr. Carlson said he did not think that the nation was on the verge of a major malaria outbreak. But as international travel ramps up this summer, the number of cases of imported malaria could increase, the CDC noted.